Learning relaxation. The aims of this session are to understand the concept of the relaxation response, to learn how to introduce relaxation to patients, and to know a bit more about the different types of relaxation to help increase your confidence in discussing this with patients. So firstly, what is relaxation? So what's the difference between relaxation activities and relaxation techniques? So relaxation activities could be reading a book, watching TV, lying in the sun, anything really that you find relaxing. Relaxation activities help to reduce stress, and they are really important and valuable to integrate into our daily routine, but they may not always be deeply relaxing. Most of these activities might not initiate the relaxation response unless they encourage a calm focus of our attention. They can still reduce stress though, so are still an important element to discuss with patients. So moving on to the techniques then, true relaxation is something that is practiced and cultivated. It is defined by the stimulation of the relaxation response. True relaxation is a skill and it's improved with practice. As defined in this slide, it's something that's practiced and cultivated, and that's something that's really important to tell our patients that we need to do. The state of relaxation isn't sleeping, and that is something commonly discussed. Doing relaxation exercises, though, can help you to fall asleep, but you won't be in the relaxation mode whilst asleep. It's something that we cultivate consciously. So, what is the relaxation response? The part of your nervous system that controls stress and relaxation is the autonomic nervous system. This system controls functions within the body such as the heart rate, respiratory rate, digestion, amongst other things. There's two sides to this system, the parasympathetic nervous system and the sympathetic nervous system. Here we will look at the parasympathetic nervous system. The activation of this is otherwise called the relaxation response. It is the mode our body goes into when the brain perceives no immediate threat. Your heart rate and respiratory rate lowers, digestion can occur, and muscles relax, amongst other functions. It also repairs damaged cells, which support our immune system. You may feel more relaxed when you're in this system, and it's an important element of our well-being. Again, to initiate the relaxation response, it's a skill that needs to be developed, and it can also support our occupational balance. Here we have the sympathetic nervous system, otherwise known as the fight or flight response. This is activated when the brain perceives a threat, either physical or psychological, such as a worry. It is a natural response which triggers our heart and respiratory rate to increase. Our blood pressure might go up and muscles tense, ready for action. This is often associated as a caveman response, needed to support survival in that age when physical altercations would have been common. These days though, it doesn't have to be something physically threatening happening near us or to us. It can be a worry or a problem needed to be solved which initiates the response as well. Stress can be positive for you though. If we didn't have this response, many of us would struggle to overcome challenges on a daily basis. You might think of this as a seesaw. The process of relaxation is to bring the seesaw back into balance. Due to life situations, it's inevitable we will experience times when the seesaw is not in balance. It's not possible to achieve this all the time, but if we can show ourselves and our patients it's possible for us to do something about it ourselves to help the situation, it can be a positive step forward in resilience. Severe breathlessness sets off the internal alarm system in the emotional limbic system part of our brain. This also automatically causes a fight or flight response, i.e. an emotional reaction. This can contribute to feelings of panic if a patient became very breathless and shows how often they can be experiencing these symptoms as breathlessness is such a common side effect of their condition. Here's a more visual image of the two different systems and the response they provide. This can be a useful image to show patients to help their understanding in relaxation and why it can be beneficial. On the one side, we've got stress, which increases our arousal, breathlessness, heart rate, blood pressure, our temperature in the body, which can cause sweating or clamminess, muscle tension. And on the other side, when the relaxation response is initiated, you can see the opposite happening. Our arousal going down, our breathing relaxing, our heart rate, etc. So why do it in the first place? So when we're stressed, our body activates the sympathetic nervous system, as we've just discussed. This is hardwired within us. Relaxation can help us switch from the sympathetic nervous system to the parasympathetic nervous system. This is really important to gain a better balance in our lives. Stress can also cause avoidance behaviours and impacts on our well-being in that way. It can stop us doing activities or actions that are important to us, and it can isolate us in the process and it make things feel harder to manage. Relaxation can be beneficial for both the physical and the psychological impact of stress and anxiety. I often get asked how to introduce relaxation to patients. My answers are that it can be really useful if you've tried the techniques yourself first. It's useful to know if they've already got an understanding of the concept already. Have they tried any techniques before? Which have they found useful? Which didn't they enjoy? To start with building blocks. It's easy for barriers and stereotypes to emerge, so it's really useful to discuss the impact of stress and anxiety first sometimes, especially education surrounding the stress response, before then introducing relaxation itself. You can offer other interventions alongside, referrals to different talking therapies, looking at social inclusion needs, and examining current uses of meaningful activity that they do already, so both relaxing and stimulating. Sometimes more specialist support from the start is useful to promote engagement with a patient with more complex needs. Relaxation on its own isn't for everybody, so it's important to use psychological screening tools and other conversations and assessments to work out if it's appropriate. So where is a good place to start with relaxation? There's many different ways of achieving the relaxation response. Here are some of the formal ways. So progressive muscle relaxation, tensing and relaxing of muscles, visual imagery, there's deep breathing, meditation, hypnosis, yoga, autogenic relaxation. These are just a few, and there's many more that you might want to look into. You will probably already be aware of breathing exercises as you provide these to patients to help with breathlessness anyway. You might not have been aware though that it can also initiate the relaxation response. This is due to the patient themselves slowing their breathing, which essentially tricks the brain out of the fight or flight response and into the relaxation response by the physical actions they take. There are many different exercises you could try, but essentially any that slow the breathing will work as long as calm focus is applied. Autogenic relaxation. Autogenic nervous system influences the heart rate, respiratory rate, digestion, amongst others. It's about concentrating on different parts of the body and trying to relax these. Repeated relaxing phrases are often used when focusing on these different parts of the body, encouraging them to relax. Using phrases such as calming, warmth, free from tension. Anything that helps the patient to relax they can use. It's about raising your bodily awareness and creating an atmosphere of relaxation. It's passive concentration and something you can learn to do in different parts of your routine throughout the day. You could try this in the evening just before bed whilst you are relaxing. Start scanning from head downwards down to your feet and focusing on the different parts of your body and encouraging these areas to relax. So think about your arms and your legs, encouraging them to feel free from tension, feeling the muscles smooth out, maybe part of your face, your jaw relaxing, your eyelids relaxing. It can help restore the balance between the sympathetic nervous system and the parasympathetic nervous system. Moving on to visual imagery. Relaxation can include imagining scenery in different places. Quite often, this might be somewhere you have visited that you found especially peaceful and beautiful. It could be a pleasant memory, an image you've seen before, or a place you may like to go, for example. It's about building up the senses within the image. So, for example, say you were imagining a beach. How does the sand feel under your feet? How does the sun feel on your face? What can you smell whilst you're there? What can you see and what can you hear? It's normal to struggle to keep the image in your mind to start with. This is something you need to practice, as distraction is easy. You may even think of a previous walk you enjoyed or somewhere you used to live. Imagine walking around this area and what you see on your walk. Sometimes playing peaceful music whilst undertaking this type of relaxation can be useful to set the scene. It can be more than one place, you don't have to stick to the one image, but it's about building those images up, and when you're distracted, bringing your focus back to that image and continuing. Guided relaxation. These can be relaxation scripts that you listen to, and they can be a really good place to start for an individual. Such as with guided imagery we've just discussed, it's common to find audio scripts with these on. They might be set in a certain place, or sometimes they're left vague for you to make up your own scene. You can find these things on relaxation CDs, mobile phone apps, especially smartphones, and even in in-group sessions. It's finding what works for you. Mindfulness exercises. So although it's not actually a relaxation practice, mindfulness meditation does often elicit the relaxation response as a side effect of its practice. Ask your patient what they already do to cope with stress and anxiety. Not all previous coping mechanisms are unhealthy. Sometimes it's working out what do they need to keep in their routine and what might be better taken out. This needs to come from them, but a discussion can really help with this process. Can these relaxation exercises be incorporated into a person's routine more, along with new techniques as well? So building relaxation into your routine. It's good to start off slowly and gradually build the amount of time up. Try and do it in a part of your day that you can consistently stick to. Spending a short amount of time doing a relaxation exercise, say in the morning or in the evening, maybe at a time at work, when you're on a break. Try and find a moment to relax between tasks you might have in your day as well. A good way to start might be scanning your body for tension more often. Begin to become more aware of the physical sensations, such as with the autogenic exercises we discussed previously. Common barriers. Often patients might say there's a lack of time to practice relaxation, and we might say that ourselves as well. You can be feeling guilty as you sat doing nothing sometimes when you can feel there's so much busyness around us. Some people struggle with not experiencing immediate effects. As we've said before, there is that need to practice them to really get the benefit. So it might be that for a time after you've started different exercises, you just don't feel the benefit. But it's important to keep going and persevering, as you can achieve this after a while. Some people say there's difficulty focusing at the start, and that's fine as well. Again, it's a technique to build on, so if you find you get distracted, just bring yourself back to the exercise once you realise that's happened. Precautions in relaxation. As we've discussed, the relaxation response lowers blood pressure. Therefore, for some, dizziness could occur. We advise patients to be seated or lying during relaxation, to stop if they experience dizziness during the exercise, or if experiencing when standing afterwards, to sit and wait until this symptom subsides. In cases of some form of traumatic history, so for example, in certain environments patients might have experienced, some guided imagery may not be appropriate to pursue. This would be good to discuss with your patient before offering interventions. Some types of relaxation may not suit the individual, so thinking about progressive relaxation, tensing and relaxing muscles. If some patients have problems with pain, then this might not be appropriate for them to do. And it's to be completed in an appropriate setting, so in a darkened room if possible, sat in a chair or bed with head and neck supported, no distractions around, and obviously not to be done when driving. So here are some further resources that you could look into. Thank you for listening.